Imagine feeling like you just emptied your bladder, only to find yourself leaking a few moments later, or experiencing a constant dribble throughout the day. It is a frustrating and often confusing experience, leaving many wondering why their bladder just will not cooperate. Overflow incontinence is a type of bladder leakage that occurs when your bladder does not empty completely, causing it to overfill and leak urine. The good news is that there are several effective treatment options available, focusing on restoring proper bladder function and managing symptoms, often starting with conservative approaches. This condition typically arises when there is either a blockage preventing the bladder from fully emptying, or the bladder muscle itself is too weak to contract effectively. A common cause of blockage in men is an enlarged prostate, which can squeeze the urethra. In women, a prolapsed organ can sometimes create an obstruction. Weak bladder muscles can result from nerve damage, perhaps due to diabetes or spinal cord injury, making it difficult for the bladder to push all the urine out. Treatment strategies often begin with lifestyle adjustments and behavioral therapies. Double voiding, which means waiting a few minutes after urinating and then trying to go again, can help ensure your bladder is as empty as possible. Timed voiding, where you schedule bathroom breaks at regular intervals, helps prevent overfilling. Pelvic floor exercises, also known as Kegels, strengthen the muscles that support your bladder and urethra. Your healthcare provider might also suggest dietary changes, such as reducing caffeine and alcohol, which can irritate the bladder. When lifestyle changes are not enough, medical interventions become important. Medications can help relax an overactive bladder, improve bladder contractions, or shrink an enlarged prostate. For cases caused by significant blockages, medical procedures such as catheterization might be necessary to drain the bladder regularly. In some instances, surgery may be considered to remove obstructions, such as prostate reduction, or to correct a prolapse, offering a more permanent solution. An insightful aspect of managing overflow incontinence is understanding the concept of post-void residual volume, or PVR. This is the amount of urine remaining in your bladder immediately after you urinate. Measuring PVR helps doctors determine if your bladder is emptying sufficiently and guides treatment decisions, particularly when considering catheterization or surgical options. Addressing this underlying issue comprehensively leads to better long-term bladder health and improved quality of life.